the health behaviours that affect Ontarians are what the World Health Organization calls the safe behaviours. So S is for smoking, alcohol, A is for alcohol or excess alcohol, food, so unhealthy diets, and E is for exercise. It's important that these are all modifiable, number one. The second is important that to realize that these affect many, many parts of your health. So originally we thought that smoking may cause lung cancer and then heart disease. About 10 or 15 years ago, the list was 50. Now we think with almost every disease is affected by smoking. Diet and physical activity are the same. Cardiovascular disease, diabetes, cancer, all the big health conditions are affected from these health behaviors. This study is what we think is the largest, the most robust, and most comprehensive examination of health behaviors and healthcare use that has been performed in the world. It was made possible by a lot of people giving their time and answering questions in the Canadian Community Health Survey. That's a survey that's performed by Statistics Canada. People answer it anonymously, but they also are asked if they are willing to share their information with policy actors and share their information in a way that can be linked to their healthcare use. So all the names are stripped off after we link their responses to the healthcare use, and we use that as the basis of the study. We looked at over 80,000 Ontarians, and we looked at a wide range of government-funded healthcare services. So what the government is funding: physician services, hospital care, drugs, home care, the list went on. I'm always surprised by how much unhealthy living affects your health. And for this report, I was surprised by how much unhealthy living and social demographic risks affect the healthcare system. So over a 10-year period, we attribute unhealthy behaviors and social demographic risk factors to $134 billion of healthcare. That is $134 billion that could be avoided or is avoidable and modifiable through healthy living. That equates to 37% of all healthcare dollars. So we looked over the 10-year period and followed how health behaviors changed and said if they didn't change, or how much do we save from improving health behaviors? So that number is 4.9 billion. Total healthcare expenditures, 1.9%. That may not seem like that much, but it really is in the context of other things that we see influencing the healthcare system. So even something like aging. So when we reviewed reports, we saw the words for the aging crisis, tsunami, all these catastrophic terms. And for every dollar we see increase for aging, we have seen a 20-cent reduction from improving health behaviors. What's also important for me is that most of that improvement we saw through reduction in smoking. So I think for me this is a real celebration of the success of the effort that we've done with public health policy for reducing smoking. What we didn't see very much at this point was reduction in healthcare from improving physical activity and diet and food. For me, that is a reflection of the effort or lack of effort that we put into these. So we've just started to scratch the surface about how we can make our food supply healthier, how we can make our diets healthier, how we can build our cities and our communities to be more physically active. So I see the tremendous potential and a tremendous amount of this health premium that we haven't really thought of in terms of what we see when we're improving health. Well, one question that people are already asking us is, what does this mean? How can we use this report? And how we see this report is starting to create a roadmap seeing the magnitude, the potential in terms of reduction in expenditures, or how we can create a sustainable healthcare system. So we've already seen a $4.9 billion reduction, largely from the efforts of, or from the effective decrease in smoking. There's still a tremendous amount that we can gain from decreased smoking, but it also shows us that all the health behaviors are important, very important for healthcare costs. And if we can create that same momentum or that same direction with especially physical activity and diet as we did with smoking, we will see that we will continue or even get larger reductions in healthcare expenditures.